Where are the solutions? This is what everybody was saying about my viral video on Affordable Care Act, or Obamacare. But he said, you did a great job pointing out all the flaws with it. But where do we go from here? The places we go from here are, number one, educate as many people as possible. So we demand that Congress does the right thing. They need to tear the Affordable Care Act apart. First thing we need to do is we need to give people choices. Right now, you are mandated to have lots of coverage that you don't need. So first is let people buy a catastrophic only plan. That would be the best scenario, and let them pay out of pocket for most of their health care. Now, most people say, wait a minute, I can't afford to pay for health care out of pocket. It's too expensive. Well, the reason it's too expensive is the insurance industry is telling you what the price is. If you actually get the cash price, it's much less. I'll give you an example. You go in for a CAT scan, you go into a hospital, $5 grand. I've seen them as high as 10 grand. However, you could go to a great imaging center in town, high quality imaging center. You have board certified radiologists reading the scans, and that's going to cost you $350. How do you pay for that? You have an expanded health savings account with your catastrophic plan. This puts you in the driver's seat. When you have the ability to pay cash for services, you get treated well. Right now, you go to the hospital, you get treated terribly. They don't care about you. They care about the insurance company. They want to make your insurance company happy about you, and you're an annoyance. When you pay cash and you go to an imaging center, you're treated very well. People are respectful. We're glad you're here. I don't hear that when I go to the ER. So that's the first step. Second step, if you are on generic drugs, which 90% of drugs that are sold in America, you're better off to pay out of pocket. Why is that? Most generic drugs cost $4 to $6. You can get them at your independent pharmacy. Right now, if you have a $1,000 plan, you're paying probably $200 to $250 a month for your drug prescription coverage. Then you have copay. You're paying probably 40 times more for your drugs. So just go ahead and get your drugs, get your imaging, and physician services, if you start paying cash, are much more affordable. If you need a procedure like a colonoscopy, you can get a colonoscopy done anywhere from $900 to $1,200 would be a typical charge. So that's very easy to get done. If you go through insurance, it's going to be much higher.